even to think of it in purely economic terms. It's the right thing to do. Get people healthcare, right? It seems so obvious. It's a wonderful day in the homiehood, a wonderful day for a homie. Won't you be my homie to Taro? Doug Ford is an absolute POS, which, if you don't know, stands for point of sale. And literally anyone can just come up to Doug Ford and give him some money and get what they want. Ontario to end paid sick days program lift some COVID-19 measures in long-term care homes. As a time-limited pandemic measure, the Ontario government introduced paid COVID-19 leave, a program designed to support people who needed to take time off work to isolate or get vaccinated, the statement said. So if you don't know, the pandemic is actually still happening, and people can still get sick, not only from COVID-19, but even from other things. And I think it's important for them to have sick days. I'm not sure about how you feel, but personally, I think sick days are a really good policy, because in some ways they even save money, because you're keeping the sickness that you have in your home and you're not spreading it out to all the people that you work with. But we've canceled these additional sick days here. Ontario has now achieved one of the highest vaccination rates in the world, and consistent with the sunset date for the program, it will expire effective March 31st, 2023. So this is one of those things where it's like, you heard everyone be like, oh, don't worry, the pandemic is going to be fine. We're going to build back better. And this would be one of those things that falls into that category of building back better. But since we can't have nice things, it's like, nope, actually, we're taking that away. So sucks to be an Ontarian. The news comes the day before a province is set to table its budget for this year. NDP leader Marit Stiles said her party was pushing for 10 guaranteed paid sick days for all Ontarians, plus an additional 14 government-funded paid sick days during a public health emergency. This government is no friend of Ontario workers, Stiles wrote in a statement. Nobody in Ontario should have to go to work or leave a sick child because they can't afford not to. And that is the sad truth, is that if you don't have sick days, if you have to choose between making money or taking time off to be sick, you're probably going to end up rallying, just like hopping yourself up on some Dayquil or whatever and getting your ass to work. Because what are you going to do? Not feed your children? Not feed yourself? Under the program, employers are reimbursed by the government for the paid leave days. Eligible workers can receive up to $200 per day for up to 3 days for pandemic-related absences like testing, vaccination, isolation, or caring for relatives who are ill with COVID-19. Ontario's Labour Minister said this week that the program has served more than 500,000 workers. And what's going to happen to the 500,000 people who have already accessed this, or rather the people who are going to continue to need to access this in the future? It's not like suddenly all the people accessing this are not going to need this anymore in their lives. So we're basically just saying, sorry, screw you, get to work. I don't care if you're sick. In a separate announcement, the province announced it will also start lifting some COVID-19 restrictions in long-term care homes at the end of the month. Brutal. This is actually one of the things that kind of like really just like pisses me off. Starting March 31st, homes will no longer need to test staff, caregivers, and visitors who don't show symptoms of COVID-19. Recommend staff, caregivers, and visitors wear a mask outdoors unless staff are close to a resident. Perform daily temperature checks or screening of residents returning to a home. Now, this is something that is just like, you know how easy it is to check a temperature? Like, why would you stop doing this? It's wild. Like, when I was in the hospital, they would take my temperature every time I sat down in a chair, because that's just like standard protocol even before COVID-19. So, like, they're no longer required to do this? That's shocking. Keep the limit of one caregiver at a time during a COVID-19 outbreak. or when a resident is symptomatic or isolating. This is really concerning. This is like, even when they know there's COVID, they're saying you don't have to follow any rules. Like, even when everybody knows that someone in a long-term care home has COVID, they won't have to. They're like, hey, go, everyone go say hi. Don't worry. And by the way, you don't have to like take any other precautions or even take their temperature. But we know they have COVID. Okay. And then what happens if like some of these nurses get sick too? Like they don't have sick days. Oh my god, this is just like a crisis. Like what they're just like, what if we made things worse than they already are? Oh my goodness. Adjust physical and social activities to include physical distancing. I mean, like, let's face it, come on. Like the old people in old folks' home, they probably don't care that much about this anyways. Even with a COVID outbreak, wow, people will die. Yeah, I know. They're basically like what if we just let people suffer and die? Provincial data shows that 5,335 nursing home residents have died from COVID-19 since the pandemic hit Ontario in early 2020. 13 long-term care home healthcare workers have also died over that time frame. And I mean, you think being a healthcare worker, you might want to access some of those sick days that were taken as a pandemic measure. The sad part is too that the pandemic it's raging on. In early 2023, we saw the highest rates of infection that we've ever seen throughout the entire pandemic. And a lot of people like are cheering this on like idiots, saying that we've achieved some sort of herd immunity. But newsflash, COVID-19 actually weakens your immune system. So the more times you get it, the weaker your immune system gets, and the more likely you are to get it again, and the more likely you are to get long COVID. We've probably all heard of a friend who like got COVID and like, oh, the first time it was just a cold. The second time it was like still like just a cold, but it wasn't so bad. But the third time it was like, oh man, that was like the worst I've ever felt. And it didn't go away for like a month. You know, like how many anecdotes do you hear like that? 13 long-term care workers might still be alive with increased sick days. Yes, exactly, Ribbert. You know, and in addition to this just being horrible because like this man doesn't give a fuck about any of us and our families, it's also just like an anti-worker sentiment that only an evil conservative supervillain can possess. And there's more. Ontario extended medical care coverage to uninsured patients during pandemic, but that's ending. So basically, we had universal healthcare for a very brief period of time. You know, universal healthcare in so much as we in Canada can ever have it in our current neoliberal state. But in this sense, it was extended to migrant workers and people on work permits. And let's say you were crossing the road at Roxham Road in Quebec and you needed to access healthcare during the pandemic. Well, at least in Ontario, you could access that care even if you were undocumented. However, that's ending because we only care about public health and migrants, in so much as it might affect well-to-do rich white people in Toronto. So Rose Celeste of Toronto says she spent years avoiding a visit to the doctor. As an undocumented migrant worker from the Philippines, she feared something as simple as a checkup could lead to a run-in with the law and jeopardize her life in Canada. But when the COVID-19 pandemic hit 3 years ago, that changed. The province directed hospitals to temporarily provide medical necessary care to patients without coverage while it reimbursed them for the expense, something that led Celeste, 61, to discover and then treat her thyroid cancer. Yes, it turns out that going to get checked by a doctor is actually a good thing, and it's something that actually strengthens healthcare across the board. we shouldn't just think that healthcare is for rich people, but we know that this government is doing that. They're trying to privatize, they're trying to section off people from accessing healthcare. And this is one of those moves. Without the program, she estimates she'd be thousands of dollars in the red, trying to pay for health care herself, or worse, dead. For migrant workers like me, this is very important and this is very crucial, said Celeste, an active member of the migrant workers movement in Canada. My God, you can just imagine how happy I am. So she genuinely thinks that she would probably be dead if not for the COVID-19 pandemic. This woman would not have been able to access healthcare in Canada. Something that we constantly brag about being a universal healthcare program that's so much better than the United States of America. And it's like, no, it's not. It's trash. Let's fix it, not defund it. Despite this, the province confirmed it's winding down this program, citing similar reasons in line with its recent move to end its paid sick days. Now this is, where did it go? I had it. I lost it. Okay, yes. So this went out in an email on Friday afternoon, which if you're unaware, that's when the time governments choose to deliver shitty bad news. So this went out in an email and it just said like, "Hey, just so you know, the Ontario Medical Association is sad to let you know that the Ministry of Health, aka the Ford government, is winding down this program for uninsured people to access healthcare." Really shitty, really sad. And this person, Lorraine Lamb, is saying that this is going to affect new immigrants, those with expired OHIP, migrant workers, foreign visas, students, those waiting for humanitarian claims and sponsorship, and returning Canadian citizens. And it's just so stupid. It's frustrating. In a statement, the network called the ministry's plan to end the program devastating. If you have to choose between feeding your family and treating an infection, those are not real choices. People will choose to feed their families and they will suffer, the network wrote. We know how the story ends. It's not good for patients, for families, and not the healthcare system. This program needs to be made permanent. Now, this is coming from the network here. I believe it's this network, OMA. Or a similar network. Okay, the Health Network for Uninsured Clients. I usually try to highlight this stuff in orange so I can go back and find it. Of which this Dr. Edward Shi is a member of. So, you know, very young, handsome Asian doctor. And he was one of those professionals polled. Before the program came into place, he recalls watching patients forced to choose between paying for healthcare that they need and the bills that they have to pay, and sometimes leaving the hospital untreated because of it. To extend healthcare to uninsured Ontarians and then take it away is something she calls terrible. And that's what's like most disappointing about this. It's like, hey, one good thing came out of the pandemic. We actually were able to extend healthcare to people who were not able to access it previously. And then, like, what if in Doug Ford's like evil mansion that is his underground lair or whatever, wherever supervillains live, he's like, what if we pulled the rug out from under those people? And not only that, but we're gonna do it on March 31st, which is like 4 days away. Like, so you basically only had 1 week in order to consider that you might need to access healthcare for the last time. That's evil shit, man. For the last 3 years, we've actually had a universal healthcare system in Ontario. I mean, this is truer under this, but it's not entirely true. Where if you're living or working or studying here, you can actually just walk in and get essential healthcare, he said. Imagine living in a country where you can just walk in and get essential healthcare. Isn't that what Canada is constantly bragging about every time like somebody gets a $100,000 bill in the US? We're like, oh, well, that would never happen in Canada. It's like, yeah, because people aren't even allowed to access care in the first place. But until something can be done for the long term to help improve care for this group of people, OMA says that it's asking the ministry to extend the program. And we really hope, that is something that can happen. Like, this basically needs to be stopped. NDP health critic France Gelenas called the move against the small program cruel and inhumane. Ford and Conservatives are turning their backs on some of the most vulnerable people in Ontario, she said, referring to Premier Doug Ford. The Ontario NDP won't stop until this decision is reversed because healthcare is a basic human right. It seems so obvious. A permanent program of healthcare coverage for uninsured people living in Ontario. It happens to be both a smart thing to do and the right thing to do. And that is what is so frustrating about these things. It's like, actually, it's good. It's good for all of us that everyone living in Ontario, our neighbors, the people we work with, our families, it's good for all of us if they can access good quality healthcare. So I love this line here because it is the smart thing to do. It is the right thing to do. Because if our family members die, we take up time off work, right? If our family members are sick and they can't access care, who's going to have to care for them? We are. Which in the long run, like, to think of it even in purely economic terms, which is disgusting, yes, because we should be thinking of this in humanist terms. But even to think of it in purely economic terms, it's the right thing to do. Get people healthcare. Right? It seems so obvious. But we're not doing it. Because of Mick Dofo being a POS.